Michel Goldman, you have a question?
Yes, regarding advertisement and coming back to obesity. As you know, we have now these glucagon-like peptide-1 agonists, which I would say are very profitable for several companies. And there is advertisement in the general population about these drugs. So since we will also consider the economical impact of what we are discussing, could you comment on your position on these new drugs to tackle obesity and diabetes?
Say something. Or, I don't know if Professor...
Come on, and I will comment after. Yeah.
No, just in general, if we think that we can address this kind of global epidemic phenomena like obesity, we speak about globesity, this new this neologism that has been invented, or even cancer, for example, just by fostering the cure and not the primary prevention, we are in the wrong way, because the costs of getting an enormous and a huge quantity of people to get them access to grant this, to hold these people access to this costly drug for cancer treatment, for obesity treatment, they are so huge that we can even imagine that any healthcare system, even public or based on insurances or private, can afford. So we are on the wrong way if we don't foster primary prevention and we just rely on the cures in general.
If I may, for the first time, I will be a bit controversial on that aspect. My feeling is that the drugs you just mentioned, GLP-1 agonists, are game changers. And we maybe not see that today because they are very recent, but I think that we should at least observe them. And they are game changer because, of course, you are totally right that the first goal is the primary prevention through the change in behaviors. Healthy diets, exercise, physical exercise, less problematic use of alcohol, abstinence of cigarettes. That's clearly the goal. But we face our limits with primary prevention only. And these drugs have proven a lot of efficacy in randomized clinical trials. Since, 22% of the Belgian population is obese. It's not very visible in this audience. Why? Because there is a social gradient with obesity, which is very strong. The most vulnerable segment of the population suffer much more from obesity. And obesity is a risk factor for many conditions, many chronic conditions. You mentioned health brain, but the health brain, it's a determinant of dementia today, which is clearly known. So fighting against obesity, fighting against diabetes, fighting against the consequence of obesity, which has been proven by these drugs more and more. There are not a single day when a new randomized clinical trial with a very strong evidence produce some results which are beneficial for these drugs. I have absolutely no conflicts of interest with regard with these companies and these drugs, I can tell you. But really, as an epidemiologist, I want to observe them with cautious and to think that maybe they will prove to be game changer, probably as the statins have been game changers in hyperlipidemia problems.
We are not in contradiction, because concerning secondary prevention, I totally agree.